Welcome back to the Operation Freedom YouTube channel. What we do here is shine the light of truth on the deep state. They hate that. We do it figuratively with our presentations. We do it literally with our sponsor's product, PatriotLegacy.com. PatriotLegacy.com, featured product of theirs, the Patriot Beacon. 6 overall lighting functions. In addition, solar powered, don't need batteries. You can charge your other devices like your phone from it. In addition, you got a compass, you got a window breaking hammer, and you got a seatbelt cutter. Plus, if those deep state dweebs get just a little bit too close to you, blast them with this. They're gone. Go to patrioticlegacy.com, patrioticlegacy.com. Get yourself, your kids, your grandkids, your car. Can carry it with you anytime. patrioticlegacy.com, the Patriot Beacon. So what'd she know? How about this? She knew that something that was done on March 10th, the primary, occurred. Who works the polling stations? Elderly folks. One of the groups that's so vulnerable. When I went to vote on that Tuesday, March 10th, I brought my own pen. I put the foam on my hands, which lasts 4 to 6 hours before I walked in. And I brought my own pen. They handed me a piece of paper to sign my signature, and the lady very nice lady, handed me a pen. I said, "Oh, no, thanks, I'll use my own pen." She kind of looked at me like, "What's with you, buddy?" There was no hand sanitizer there, no wipes, no nothing. She then asked me, "Well, I need to see your driver's license." I go, "Fine, I'm going to hold it and I'm going to show it to you." She kind of looked at me like, "No pen and now this?" Yeah. Then I go to get my ballot. Nice guy, elderly gentleman, hands me the ballot and a pen. No pen, but I got the ballot, paper. And we do know the virus does hang out on paper. So then I go to vote. These little cubicles, little thing, you sit there. There's a person voting next to me, not 6 feet away. They have everybody spread a foot away. And there's another pen there that a bunch of people have already been grabbing, right? The former Secretary of State of the state of Michigan has stated that, the poll workers were not prepared for this virus on the March 10th election. There are many folks that have said that it shouldn't have occurred. That event led to an environment where the virus could spread more, and we were seeing the ramifications 2 weeks later. So we've had a confluence of errors with Governor Whitmer. And this is true if you analyze your own politicians in your state or in your country. The same is true. They've dropped the ball across the board. But boy, do they all love to, anything that happens, they point the finger at President Trump. Oh, it's his fault. Wait, stop. It's his fault. So, first, she holds a primary, which helps her politically, right? Because now she might be in the number 2 seat. Can you imagine that? Okay. 2, she deep sixes the negative information. Some of us put pressure on her. Now she has to cough that back up. Then she does this shelter-in-place order with fraudulent data. We call her out on that. Now she's working with U of M supposedly to get better models. Great. And then she drops the big one. This is absolutely unconscionable, what she did. And you better make sure it doesn't happen in your state because it's already happened in Nevada. This is from a very courageous writer with the Detroit News, Kathy Hoekstra. She got a lot of grief for this, and I got a lot of grief for talking about it. But in the end, we were right. And because we were right, we potentially saved thousands of Michigan citizens from the governors practicing medicine without a license. Listen to this. Michigan doctors fight coronavirus and the governor's office. The coronavirus is unquestionably a significant threat to the health and safety of people throughout the world. There is a silver lining, however, in the numbers of people who are recovering from coronavirus. More than 122,000 at the time of this writing. As I said, you never hear that in the lamestream media reports, right? Even greater hope lies in a promising new treatment using a combination of old drugs, generic, cheap. Big Pharma doesn't like that. Plaquenil, hydroxychloroquine, and a Z-Pak, the antibiotic, azithromycin. These well-known drugs have very favorable safety profiles. Several small studies have shown significant reduction in viral loads and symptom improvement when combining these medications in coronavirus patients. The authors of the most famous study concluded, quote, "We therefore recommend that coronavirus patients be treated with the hydroxychloroquine and azithromycin to cure their infection and to limit the transmission of the virus to other people in order to curb the spread of coronavirus in the world," end quote. Based on these and other results, physicians and governments around the world are now using these medications to claim great effect. Even in the state of Michigan, prominent hospitals such as Henry Ford Hospital, University of Michigan have added hydroxychloroquine to their treatment protocols for hospitalized patients with coronavirus. By so doing, physicians are using these medications off-label, that is, without the costly and time-consuming process of the FDA administration approval. Off-label use of medications is legal and common, and it may even account for as many as 20% of prescriptions in the United States. This practice is even accepted by the FDA. Furthermore, given the severity of the coronavirus pandemic and the promise of these medications, the FDA has avoided condemning the off-label use of hydroxychloroquine for coronavirus patients. Maybe they did, but Whitmer sure didn't. Wait. But if you live in Michigan and your loved one is infected with this potentially lethal disease, you're, well, out of luck. Governor Gretchen Whitmer's Department of Licensing and Regulatory Affairs. She had her Department of Licensing and Regulatory Affairs. Now, let me tell you something as a provider. You get a letter from these folks that's signed by the head of enforcement. Boy, you talk about a red flag and it wakes you up. Okay? The fact that this was delivered through the Department of Licensing and Regulatory Affairs, this letter signed by the enforcement director, was in and of itself a threat, let alone what the contents were. Governor Gretchen Whitmer's Department of Licensing and Regulatory Affairs literally threatened all doctors and pharmacists in the state who prescribe or dispense hydroxychloroquine to treat coronavirus patients. The agency's March 24th letter warns physicians and pharmacists of professional consequences for prescribing of hydroxychloroquine and chloroquine. The letter deviates into open threats of, quote, administrative action, end quote, against the licenses of doctors and pharmacists that prescribe or dispense hydroxychloroquine. The letter also instructs pharmacists to ignore physicians' orders for this medication. Even worse, the letter indicates that healthcare providers are, quote, now get this, tell me if this isn't like the 1940s, quote, required to report, end quote, their fellow physicians who are prescribing these medications. This draconian measure carries ominous Gestapo-like overtones of neighbor reporting neighbor to authorities. During a time of crisis in which physicians continue to see patients despite not having enough protective gear, this threatening authoritarian stance from our governor is counterproductive at best. It sure was. What makes this directive even more a head-scratcher is that same day the state issued its threatening nastygram to Michigan's healthcare providers, Whitmer's counterpart in New York, Cuomo, started clinical trials of the very same drugs. The implications of Whitmer and her administration's knee-jerk scare tactics should terrify all Michigan residents. Not only is our state's top leader threatening the selfless healthcare workers who are on the front lines trying to save lives, but she's denying possible life-threatening medications to actual coronavirus patients. Let me tell you something. That reporter got grief. And I got grief when I started talking about it. And the reason is because this was a 4-page letter from this Department of Licensing and Regulatory and Enforcement Affairs. Okay? The first paragraph was about doctors hoarding the medication. Okay? The first paragraph. Now, look, any doc prescribing the medication for people that don't have this, that's wrong. Wrong, 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 wrong. And there should be disciplinary action, or at least an investigation if that occurred. And if so, then a question of disciplinary action. I agree with that. If that letter would have started and stopped with that first paragraph, fine. It's the second, third, and fourth paragraphs that are problematic. And there were people out hooting and hollering at this reporter and me, saying, this was only about hoarding and you're a bad person for taking on the governor on this. No, all of those people who rendered those criticisms, one, either read the first paragraph and didn't read the other 3 paragraphs, or 2, were just mouthing off on a public policy issue. They had no functional medical knowledge and never even read that directive from Governor Whitmer, who was practicing medicine without a license. Funny that the letter came through the licensing department, isn't it? Ironic. Actually, the pinnacle of hypocrisy. I sent a memo out. Here's what I said. And there were people who complained to me about holding the governor's feet to the fire on this while people were dying, while I'm getting calls from my friends who are trying on the front line trying to take care of people saying, we're fighting a war and they're taking our ammo from us. You got to say something, Dave. Well, I did. And boy, did it make people mad. But it was the truth. The Whitmer administration, this is what I wrote, the Whitmer administration issued the directive on March 24th, 2020. It has been misrepresented as only addressing hoarding of a particular treatment regimen. If one takes the time to read the entire directive, it takes on a far different tone and in a not so subtle approach rejects a treatment option which is currently being used throughout the world and in the United States. There are a courageous few who called her and her administration out. Those that did were demonized. Unfortunately, the price that is paid for telling the truth these days. As stated, there is notification in the first paragraph about physicians prescribing for themselves, family, or friends. Needless to say, if the providers who order the medication for hoarding purposes without a diagnostic justification for an individual, that is a significant ethical issue, and they should be investigated. That harms those patients who were already taking the medication for other purposes, such as arthritis. Hoarding a vital medication is an offense which should face review and possible penalties. If that is where the letter ended, that would have been appropriate. But it did not end there. It took another step. It disqualified the use of a medication regimen that's being used around the world. It is the second paragraph, which I'm about to read to you, which is sweeping in nature, that is the issue and the problem. There are no qualifications to the sweeping statements made regarding the prescribing medications. The governor and her administration have taken the position that the treatment regimen has not been proven for coronavirus and therefore should not be administered, and disciplinary action could well be taken. Here is the second paragraph. I will spare you the threats in the third and fourth paragraph of reporting others that are using this and the like. This was the second paragraph. This is bad enough. Quote, prescribing hydroxychloroquine or chloroquine without further proof of efficacy for treating coronavirus. So in other words, based on all the information that's been published, all the case reports, all the information from around our country, all the information from Italy, France, from China, from South Korea, from Poland, on the beneficial effect that has been shown. In spite of all that, if you prescribe hydroxychloroquine or chloroquine without further proof, in other words, that's not enough, for treating coronavirus, or with the intent to stockpile the drug, may create a shortage for patients with lupus, which is an autoimmune disease, rheumatoid arthritis, or other ailments for which chloroquine and hydroxychloroquine are proven treatments, reports of this conduct will be evaluated and may be further investigated for administrative action. Prescribing any kind of prescription must also be associated with medical documentation showing proof of the medical necessity and medical condition for which the patient is being treated. Again, her words, Again, and her administration's words. Again, these are drugs that have not been proven scientifically or medically to treat coronavirus. Really, Doc Whitmer? Really? Tell that to the top guy in the world in infectious disease out of Marseille, France, who stands behind this with his case studies. And with a limited small population, and as of 3 nights ago, a much larger population that had huge positive benefits. See, the brilliance of this treatment regimen is the earlier you institute it when someone gets sick, the less chance that they're going to have to come into the hospital. The less chance they're going to have a tube put down their throat, called an endotracheal tube. The less chance they'll be on a ventilator, and the less chance they'll die. The less chance that the system will be overwhelmed. She should be welcoming this. Every politician who cares about their constituents in this country and humankind should be grateful there might be something that could help rather than deep sixing it. She's trying to treat this proven treatment regimen like she did the statistics she tried to deep six. It's sick. It's beyond unethical. It's inhumane. It is this second paragraph that is the issue that providers believe blocks them from prescribing the medication regimen and pharmacists from providing the medication regimen for someone with a coronavirus diagnosis. The state's position is the existing studies and case reports are not justification to prescribe the medication regimen for a patient with coronavirus diagnosis. This is similar to what has occurred in Nevada with their brilliant governor, and I use that term facetiously. The concern, and in some cases the fear amongst those on the front lines, is that if they prescribe the medication regimen to a coronavirus patient in the state of Michigan, in spite of the existing medical studies and case reports, they will come under administrative review and possibly sanction. Research on chloroquine as far back as 2005 has shown effectiveness of the drug on coronaviruses in general. Not this specific virus, but kissing cousins of this one. It also has been presented in many public outlets in case reports from China, Italy, Poland, France, and in South Korea, actually, and in a small population study from Marseille, France, which now we have a second population study, and it holds up. That this medication regimen has been utilized at an early stage. This information was summarily dismissed by the governor. Use of the medications at an early stage have been found to prevent the progression of the symptoms that would require hospitalizations, let alone deterioration leading to, as I mentioned, intubation and the use of a ventilator. This is key to trying to prevent the overwhelming surge on emergency rooms, hospitals, and ICUs. The providers in the ICUs potentially do have some latitude in the use of medications and using as, quote, last hope justification, but even in this situation, the question has risen from providers that I've heard from, based on the sweeping position of the second paragraph that they will come under investigation at a later date for having utilized the medications based on the existing data and studies. Let's talk about what would have been appropriate if Governor Whitmer was a leader, okay, as opposed to a political hack trying to make it to the next level. What would have been appropriate in the letter from the governor would have been the contents of the first paragraph, an acknowledgement of the use of this medication regimen throughout the world and in the United States, a call for more investigations and studies to include patients and medical centers in Michigan, and an action plan of networking with the federal government and private industry to obtain further quantities of the medications. By doing so, the medications could then be utilized for those who previously were prescribed the medications for other conditions such as arthritis, and could be used for those on the front lines who are treating coronavirus patients without the threat of disciplinary action. Disciplinary action would be reserved for those involved in hoarding the medication. The bottom line with the letter that was issued by the governor's administration and the position issued by the governor's administration, if it ended after the first paragraph, it would have been appropriate about the hoarding. Unfortunately, it didn't end there. It took on a new level, a very concerning level. The entirety of the letter and the position of the governor have created a situation where patients and providers have been put at a minimum in limbo and possibly have been put in the position of being denied a treatment regimen which would alleviate the symptoms and prevent hospitalization, intubation, and possibly death. Here comes some good news. Because of that reporter, and because of me shooting my mouth off, because there were very few people shooting their mouths off, and because the people that got behind us and supported our positions, as opposed to the lemmings who followed the governor over the cliff on this, the good news is on March 27th, 3 days too late, the Whitmer administration issued a clarification and essentially has backed off the threats. That must have been a really tough freedom pill to swallow for her and her administration, don't you think? Our state, our country, awaits this governor and her administration's apology. To those who stated, quote, "This is only about hoarding," end quote, and were really nasty about it, that we were misrepresenting the governor when they were the ones who misrepresented her 4-paragraph letter because they only read the first paragraph or they only heard about the first paragraph. I suggest the next time any or all those people make further statements on healthcare policy issues, they read the entire document before they shoot their mouths off. And those who had the courage to step forward against the heavy-handed director of the governor, I personally thank them. I thank that reporter. And I thank those who stood behind us and supported us in taking on the governor on this. Because potentially, we saved thousands of lives in the state of Michigan and across the country, because God knows what your governor or your leader in your particular country would have done. That letter on March 27th, it clarifies the situation. Here's what it said. An apology is still needed, by the way. On Tuesday, March 24th, the Department of Licensing and Regulatory Affairs sent correspondence threats to licensed prescribers and dispensers, notifying them that the licensing department recognizes the growing state and national concern over licensees inappropriately prescribing hydroxychloroquine and chloroquine to themselves, family, friends, and coworkers without a legitimate medical purpose. Well, that was the first paragraph. It wasn't the second, or the third, or the fourth. The purpose of the communication was to threaten, both prescribers and dispensers of their continued obligation to adhere to the standards of practice and exercise the professional judgment applicable to their professions. Maybe these same people should hold themselves to an ethical standard, huh? The Michigan State Medical Society surprised me that they stood up, and the Michigan Pharmacists Association issued a joint statement on the subject, of which they stated, any prescription medicine that may be effective in treating coronavirus must be reserved in Michigan's sickest and most vulnerable patients, end quote. In other words, Governor, administration, you got it way wrong. The American Medical Association, I haven't agreed with anything they've done in God knows how many decades. We've been at war for decades. The American Medical Association, the American Pharmacists Association, the American Society of Health System Pharmacists also issued a joint statement regarding the same subject. Quote, the healthcare community must collectively balance the needs of patients taking medications on a regular basis for an existing condition with new prescriptions that may be needed for patients diagnosed with coronavirus. Being stewards of limited resources is essential, end quote. In other words, Governor, your administration, you were wrong, really wrong. The governor's Department of Licensing and Regulatory Affairs went on, we understand that we are dealing with unprecedented challenging crisis, but we must all work together. How do threats work into that? To address this virus and keep ourselves, our families, our friends, and our fellow Michiganders safe. The department thanks all of the dedicated licensed health professionals, really, because just a couple days ago you were threatening them, and others who continue to provide the best possible care for Michigan citizens during the state of emergency. I might say that would not include the governor or anyone in her administration that put that forward. And then this hit. Just Monday. Those medications that the governor determined were not helpful. Yeah. FDA issues emergency use authorization for anti-malarial drugs amid coronavirus outbreak. The Food and Drug Administration has issued an emergency use authorization for a pair of anti-malarial drugs as health officials work to combat the rapid spread of the novel coronavirus. The Department of Health and Human Services said in a statement that the authorization would allow 30 million doses of hydroxychloroquine sulfate and 1 million doses of chloroquine phosphate to be donated to the Strategic National Stockpile. I'm still waiting for the governor to apologize to every citizen in the state of Michigan. So here's where we are right now with Governor Doc Fake Whitmer. So she's at it again. Here we go. As I've outlined, first she allowed the Michigan primary to occur on March 10th. And some people still wonder why Michigan became a hotspot 2 weeks later. Really? Then she deep-sixed the data, as I mentioned, on the number of people testing negative for the coronavirus prior to her issuing the shelter-in-place order. She then used a model, which has been shown to be fraudulent, to issue the shelter-in-place order on March 23rd. The model was outlined as being fraudulent by Dr. Deborah Birx of the Coronavirus Task Force. Then Whitmer and her administration threatened doctors and pharmacists with disciplinary action if they provided a treatment for coronavirus patients, what I mentioned, which actually, as I've stated, is being used throughout the world and in the United States. And now listen to this. Here's what she just recommended. You ready for this? You ready? She just did a selfie video of herself talking about the virus. Okay? Did she apologize to the citizens of Michigan of putting them in harm's way for blocking the use of that medication, threatening providers who are already stressed enough with this mess? No. Michigan Governor Gretchen Whitmer says to fight the coronavirus, the citizens of Michigan must, quote, lock arms, end quote. Okay. So how does that fit into social distancing, an effective means of preventing this virus from spreading? No apology. Just more bad info. Lock arms, people. Get out there and lock arms. Whitmer's not alone. We need to keep every politician's feet to the fire as it relates to facts, data, and truth. And when they stray, they need to be outed. They need to be confronted. Civilly, but confronted. Because the health and welfare of every American is on the line. And when you mix illness with politicians, it's a nasty cocktail. One that none of us wants to drink. I predict she'll never apologize. She'll never acknowledge what she has done in this state to create a hot spot. There are other factors in the hot spot, but she didn't help it any. And she fanned the flames of the hot spot. It's truly unfortunate. And yet, she still thinks that she's going to be Biden's choice for the number 2 position. Well, and she's been angling for it. I've made the following statement. With the track record that Governor Whitmer has accumulated over the past month as it relates to this virus, and with Biden's disastrous interviews from his basement about, quote, his direct quote, how the coronavirus cure will make the problem worse, end quote. I cannot think of a better person, Whitmer, to join Biden on not, quote, the road to the White House, end quote, but on the road to nowhere. It's up to us to hold these politicians' feet to the fire. Go back to what I started with, Ben Janda's statement. In times of trouble, panic is easy. A measured, rational approach is what is difficult. It's difficult because a measured, rational approach is based on facts and on data. It's not based on a political agenda. I thank you for joining me today. I hope you'll join us for the radio show. Stream it live every Sunday, 2 to 5 Eastern, davejanda.com. I hope you become part of our Freedom family. Without our subscriber base, this YouTube channel, the radio show, and the website goes away. 30 cents a day. Sign up for a month, $9. If you don't like it, get rid of it. But I'm not sure why. Because the information you get, you'll never get anywhere else. And let me tell you something. If it wasn't for our subscribers, the radio show, the website would not exist. I would not have been able to help the other individuals who called out the governor on this monstrosity. Our subscribers are the ones who stopped the governor in her tracks. And every citizen of the state of Michigan and every American was protected in those actions. Until next time, Dave Janda signing off. Dream big and dare to fail. Thank you for your time today.